Jane Crow and I'm a GP. Androgen deprivation therapy is also sometimes called hormone therapy or ADT. I will call it ADT in this video. The male hormones, mainly testosterone, fuel the growth and multiplication of the prostate cancer cell. ADT is a treatment to reduce a man's testosterone to very low levels, and so this cuts off the fuel for the prostate cancer cell. It is often used as primary treatment in combination with radiation therapy for localized prostate cancer treatment. ADT is also used in the advanced or metastatic prostate cancer setting, where there are prostate cancer cells remaining in the body despite the initial treatment with surgery or radiation. ADT is sometimes used in the third setting, where a man with prostate cancer may be quite elderly or unwell and is not a candidate for surgery or radiation therapy. First-line ADT is given as depot injections that stay in the system for months. The injection can be given by cancer specialists, the urology nurse, GP or GP nurse. There are second-line hormone treatments that are tablets, and these also affect how male hormones work in the body, and these are taken in combination with the injections. Your cancer specialist decides if or when these might be needed. Testosterone affects every cell in the body, so when you reduce the testosterone to very low levels, there are many possible side effects. I've listed the side effects on this slide. The side effects of ADT I've grouped into 4 broad groups. First of all, I'll talk about the brain. A man on ADT might just find he's not as sharp mentally as he usually is. He might be a bit more forgetful. He often might feel more tired and might need a few more naps during the day. Sweats and flushing are very common for most men. And mood problems, for example, depression or anxiety, are common. When I talk about the body side effects, there's an altered body shape with more fat deposition around the belly. Muscles become weaker, hair becomes thinner and finer, and there can be some breast swelling. Then there's the group of sexual side effects: the loss of libido, erectile dysfunction, and the testes size becomes smaller. Under the metabolic side effects, there's an increased risk of cardiovascular disease and metabolic syndrome, increased risk of diabetes, and osteoporosis or thinning of the bones. Men may suffer from some or all of these side effects, and the side effects may be mild or they may be severe. So if you are bothered by any of these side effects, it's important to report them to your cancer specialist, urology nurse, or your GP, as there is help available. It is very important for you to have a regular GP that you feel comfortable with and who can keep monitoring you. Try to aim to check in with your GP every 3 to 6 months. There are some very helpful ways to manage the side effects of ADT. As I mentioned before, if you find some side effects are really hard to cope with, let someone in your cancer treatment team know. There are people you can be referred to that can help with counteracting the side effects. First of all, exercise. The best option is an individualized, realistic, safe, and sustainable exercise program prescribed specifically for you. This is best done by allied health professionals who are exercise medicine experts, and they are called exercise physiologists. An individualized exercise prescription can help counteract many of the side effects of ADT: fatigue, muscle weakness, osteoporosis, diabetes risk, cardiovascular risk, depression and mood disorders, and even the sexual side effects. Many men on ADT suffer from some mood disturbance. They might feel anxious, sad, have trouble coping, or be a bit more impatient, snappy, or angrier than usual. Men are often reluctant to speak to a psychologist, but it is sometimes worth meeting up with one at least once to try and see if counselling can help. Psychologists are very experienced in helping men with mood disturbances, and also their partners who may also be experiencing some distress. Men on ADT usually suffer sexual side effects: loss of sexual desire called libido, and difficulty or loss of erections. If these side effects are bothering you, then there are some things that may help. There is evidence that exercise can help sexual side effects of ADT, and there are treatments for erectile dysfunction, for example, medications, vacuum devices, tiny injections. Ask someone in your treating cancer team about this. Psychologists and sexual counsellors can be very helpful to address the sexual side effects of ADT and any relationship problems that may arise as a result of the sexual problems. Regarding diet, ADT can cause an increase in fat deposition, especially around the abdomen and waist, and this can increase the risk of diabetes and cardiovascular disease. Generally speaking, a diet rich in vegetables and fruit, fish and nuts is recommended. Reducing sugar, processed carbohydrates, soft drinks, and food high in saturated fats is recommended. Obesity is associated with poorer cancer outcomes, so if weight loss is medically advised, a dietitian referral can be very helpful. A dietitian can give you expert, detailed, and individualized recommendations for you. Calcium intake is important for bone health for men on ADT. It is recommended that you have 3 serves of calcium intake per day. An example of a serve of calcium would be a glass of milk, tub of yogurt, a handful of almonds, some sardines, or fish with edible bones. If your dietary calcium is not adequate, then a calcium supplement is advisable. When you are on ADT, you need to have different things about your health monitored, and so it is a very good idea to see your GP about every 3 to 6 months. When ADT is started, a baseline blood test to check for cholesterol and diabetes is recommended. And when we're looking after your bones, when you start ADT, it's important to check your bone strength with like an X-ray called a DEXA bone density test. And then you have another test about a year after, and then from then on every 1 to 2 years after that, depending on the results and why you take the ADT. It's important to have your vitamin D checked, and you may need a supplement if your vitamin D is deficient. Also, baseline weight and blood pressure needs to be recorded. If you need a referral to an allied health professional, you can ask your GP to arrange a care plan or a mental health care plan so you can access Medicare rebates when you see the allied health professional or the psychologist.